Thank you very much for your patience, and thanks too to the IT guys that have sweated here for the last 15 minutes. So good afternoon. The majority of our audience this afternoon are actually trying to webcast, so thanks to your virtual people out there who are webcasting. I hope you've all got an agenda. We will be following the agenda today. And also for your information and for those listening in online, this session is being recorded and will be uploaded onto the APHCRI website for your convenience later. So referring to the agenda, our presenters today are Mr Bob Wells, who's the Director of APHCRI, Vicki Murphy from Doha. We also have Jan Williamson from Doha in the audience, so thank you for coming, and Peter Mcinnes, an APHCRI link with Doha now, which is great for 12 months. Mr Will Wright, who is going to be moderating our questions and answers later on, and myself. So with regard to the agenda, Vicki and Bob will welcome you properly very soon. Then we'll be looking at how to prepare the application and some of the things that are different from this round to last round. And we'll do the questions and answers at the very end so that we can get through all of our information first. So Vicki, if I can ask you to come up and take over.
Right, can you all hear me? Thank you for inviting the department here, Department of Health and Ageing. I'm pleased to be setting aside Bob Wells. This strategy around development of the Centres of Research Excellence has been a joint piece of work over the last probably 18 months with APHCRI, and we're pleased that our contribution to this particular component of the PCREs strategy has come to fruition. First of all, I'd like to start by saying that the Commonwealth Government, as you know, has funded the PCREs strategy for over 10 years to about $135 million, which is a substantive investment for us into research. The PCREs strategy funds a number of elements: the Australian Primary Healthcare Research Centre Institute, PCREs in South Australia, in Flinders University, and also funds the remaining research capacity building initiative, which, as you know, concludes the end of this year. And we still have some small fellowship and scholarship arrangements in place at the moment. In July last year, the Minister for Health and Ageing, Minister Roxon, made a policy decision to redirect the RCBI money that's available into a competitive grants program and to begin a program for Centres of Research Excellence to be administered by APHCRI and to start in 2012. And I guess that's what you're all here today for, and to hear about this second round of CREs and what we're expecting of them. Doha has vigorously supported the ongoing funding of the PCREs strategy, which has three main goals: build capacity in the primary healthcare research sector, generate high quality and robust evidence and research to add to the body of primary care knowledge already available, and to actively disseminate the research and promote knowledge exchange. The selection criteria for the Centres of Research Excellence, which you're all about to hear from Bob about, articulates in its requirements this ongoing arrangement for capacity building as part of the CRE network. For disseminating research and promoting knowledge exchange, the PCREs strategy is looking at PCREs in South Australia to take a lead role, although obviously the role of the individual CREs and APHCRI are going to be just as important to disseminating the knowledge that comes from the CREs. Thus, generating research knowledge is the sort of thing that we would like the CREs to continually to focus on, and what I'd like to discuss further with you today. Doha, as you know, the Department of Health and Ageing and the government is fairly actively involved and intensely involved at the moment of implementing some of the major reforms in health in Australia, and particularly in primary health care, which is taking, as a result of the Minister's recent announcements, is taking a real priority focus in reform across Australia. In terms of primary care, we need some of the tough, big questions answered, and we see that some of the CRE work will actually give us that capacity to have some of those questions answered. And some of the sub-themes which will be falling out of the CREs are going to be important to supporting the implementation of research. Research around Medicare locals, how they operate, how they work within the primary care sector is going to be a significant work for us. Multi and interdisciplinary teamwork and care delivery models will be important. GP super clinics and the role they take in primary health care space. After hours access for all Australians will be an important agenda for us, and the enhancement of the role of nurses in the primary health care system will be just as significant. There's also much work to be done in the areas of chronic disease, maternity services, telehealth options, work around e-health, the personally controlled electronic health record, Indigenous primary health care, clinical and administrative governance are all issues of significance in this current reform agenda. We are looking for innovation. This is specifically to be addressed in the application and selection criteria, and it's important for you to consider as you develop your CRE applications. I would also like to draw your attention to page 6 of the application process, which is around knowledge generation. This will be a significant component for us in any CRE. Clearly, not all the CREs will have a focus on those topics I've mentioned, but they will pick up many of the issues around implementing the health reform agenda. And in addition, I think some of the work in the CREs will actually set some of the focus for further policy work in the future. Where do we go from this current large investment of primary health care research, and what is the future policy agenda? And we'll be looking forward to some of those particular issues. However, to summarise, what the department is expecting from the CREs that will start in 2012, I would like to include in these elements and to summarise those for you. We want real opportunities for primary health care researchers, particularly at the postdoctoral level, to participate in meaningful research projects under the leadership of a chief investigator. We want research projects that are relevant to the continuum of health reform and its implementation and sets the future policy directions. We want research collaborations with associated primary healthcare sectors such as nursing, allied health workers, consumer groups, policy makers and divisions of general practice and Medicare locals. We want the preparedness to share these findings and knowledge within the APHCRI network to be widened. And we are really focused on the fact that we can do a lot better in that knowledge dissemination and how evidence is applied to the field. We're extremely optimistic that the applications that will be submitted for the CREs will be administered well by APHCRI and that they'll start in 2012, and we will well thought through, and we're looking for some clever and innovative aspects to our research approach. And we're obviously expecting some very high quality in the field as per the previous round that was run by APHCRI here. The investment of the Commonwealth monies into primary healthcare research over the last decade has set the scene for this competitive and forward-looking process, and we're pleased to build on this process and to build a successful network of CREs across Australia. Before I conclude and hand over Bob, I'd also like to mention again our investment into this whole agenda has been supported by the department seconding a senior officer from the Department of Health and Ageing, which is Peter Mcinnes, which was just mentioned in the beginning. Peter is here to work with the APHCRI network. He's based in the ANU with Bob's team, but we'll be working with each individual CRE and APHCRIs to ensure that policy engagement and the policy linkages and the commitment that we promise to give in that our policy time is available to this network to deliver research which really will take us forward in the future. I'd like to hand over to Bob. Thank you.
Okay. Thank you, Vicki, and thank you, Dagmar. Thank you all for coming, and thank you for those who are or will be online at some point. First of all, I'd like on behalf of the University to acknowledge that the traditional custodians of the lands we're on, the Ngunnawal people, and we acknowledge and respect their contribution over many generations. I'll just talk a little bit about the APHCRI strategy, primary healthcare research, evaluation and development, which Vicki mentioned. I think to understand what APHCRI is on about, you have to really understand what the APHCRI strategy is, and I see that more akin to an R&D component of an organisation rather than to a research along the side like a competitive organisation like ARC or NHMRC. So the R&D departments generally improve the products an organisation has, and products in this context are policies, and improving them, I guess, is finding better ways of implementing them or reforming them in a way that makes them more effective, and to develop new products down the track, and that's the forward-looking part of this APHCRI strategy, is that we're not just, if you like, researching for the present. We're undertaking research that will inform about issues that are just on the horizon or even over the horizon, and will be important in their time. So an important part of APHCRI then is, as one of the key elements of the APHCRI strategy, is to undertake that research. And when I say undertake, it's undertaken through a network. So you have APHCRI funded here at the ANU, but its role is to itself do research, but also to fund others to do research, and that's what we're now calling the APHCRI network. And I'll talk more about the APHCRI network further on in the agenda. So our key role is to undertake the research, whether it's not just here at ANU, but undertake it through the network. It's also to go through a process of knowledge exchange around research with policy makers. Generally, from our perspective, the key policy maker is our funder, the Department of Health and Ageing, but it extends to other governments and also to other participants in the policy process, such as non-government organisations and so on. So it's not just a relationship between the APHCRI network and the Department of Health and Ageing in Canberra. It is a much broader process of knowledge exchange. So we want to do research, we want to have knowledge exchange, and we also want to build capacity, because that's an important component. This APHCRI strategy has done an enormous amount to build capacity over the decade or so of its life, and that is a key mandate of APHCRI, is to continue to develop that capacity. And as we talk about the Centres of Research Excellence, more of that will come through. So the ultimate, I suppose, point of our research is the so what factor. And what does this mean? What impact will the research have in terms of the health system, the primary healthcare part of that system, and on policies, or what policies might be needed to deal with particular issues? So it's very much so what, an outcome focus. It's not research just for the sake of discovery, and I'm not putting that down. In fact, I'm a strong supporter of blue sky and discovery research, but for this purpose, it's to deal with the health system and its needs. We do have an emphasis in APHCRI on international collaboration. We ourselves have developed links with a number of overseas organisations, particularly with the Robert Graham Centre, a Washington-based group, Washington DC that is. And we're exploring other more formal links in other countries, and we have every year, I think, of APHCRI's existence, we've brought at least one or two international experts to Australia, and they've shared their knowledge and their expertise broadly with the Australian research community and with policy people. So that's the context for the CRE scheme, and the CRE scheme is intended, first of all, to build on the capacity that has been built through PICRID and APHCRI in its first phase, to allow more sort of bigger research to occur, and research groups to be formed that have a longer period in which to undertake their research. Typically, APHCRI has funded research for a year or 18 months or so, but these Centres of Research Excellence will have funding for 4 years, and we'll develop that critical mass, we hope, of expertise which will both strengthen the research itself but also be a great driver in building capacity. So we've already run one round of CREs. We have funded 3 Centres of Research Excellence from a process we went through late last year. They commenced early this year, and they are the model on which we've refined somewhat, as it will come out in further presentations. But basically, it's the same model of 4-year funding, looking at a broader area of research, building networks, at least more than one group of researchers involved from more than one institution, and an emphasis on building capacity and participating in knowledge exchange. I think I'll pause there, and I'll hand back to Dagmar. We do have plenty of time for questions, so we'll sort of run through our presentations and then we'll deal with the questions later on. I will emphasise that we are now in a formal process, and we have a FAQ section on our website now where if there is a question, that's taken in writing and an answer given in writing. A bit like certain politicians, anything I say you can ignore, it's only what I write that you really need to take account of. So I'll be careful what I say. Thank you.
Thank you very much, Bob. Okay, we're going to be difficult here. It's always important to come back to the principles of the application process. So as both Vicki and Bob said, we need to make sure that the application process and the proposal that you prepare will enhance the evidence base that underpins the National Primary Healthcare Strategy, and also that builds research capacity. While the outcomes will be development of strong systems and proficient and sustainable service delivery for Australian primary healthcare consumers. So keep the end users in mind when you're preparing your proposal. While many proposals may be excellent, your task is to ensure that you not only meet the requirements, but that your application attracts the interest of the expert review committee for the right reasons. You don't want them to be scratching their heads saying, but I wish they'd have told us this. Put it in. The aim of our session this afternoon is to highlight some of the application requirements that might make your application more interesting to the expert review committee than other applications. Oh, thanks. You're going to do that, are you? Thanks, Vicki. Proposals will need to demonstrate an emphasis on research capacity building through supporting PhD students and postdoctoral fellowships. Just as a guide, the current Centres of Research Excellence will expend between 45% and 62% of their overall 4-year budget on PhD and postdoctoral positions. So there's quite a heavy emphasis there. Research higher degree positions might include Master of Philosophy or other master's degrees that will focus on training of research skills and will culminate in a formal qualification that can be seen to have enhanced research capacity building in primary health care. Thanks, Vicki. This is just an example of how you might present your postdoctoral and PhD student scenario. For example, it's totally fictitious. This particular CRE is proposing 3 streams of research, and under each of the streams they've named their team and members. they've listed the number of postdocs that they're going to have for each team, the number of PhD students and the names of their supervisors. And you don't have to be pictorial about this, you can use words, it really doesn't matter. But in this instance, there's a map indicating where these PhD students and the research streams might be located. And all that sort of information is very interesting to the Expert Review Committee. We're looking at collaboration, as both Vicki and Bob have said. The principle, again, is to expand research capacity building. Therefore, we're not setting any boundaries, but we're looking for cross-sectoral research. And as Vicki said, we're looking for innovative proposals. So you might think of designing a research program that integrates several sectors, for example, public housing and primary health care, or the education system and prevention and management of chronic disease. Another example might be models of integrated care that involve public health, private health providers and health insurance company incentives towards prevention of illness or self-managed care. Thanks. Another difference to round 1 applications is that these round 2 applications have a greater focus on governance. As Bob mentioned, these centres are being funded for 4 years, so we need to actually see the mechanism that's going to make your Centre of Research Excellence functional and achieve its goals across a 4-year period. A lot can go astray in 4 years. So governance really is your steering mechanism like the rudder of an aircraft or a ship. Effective governance achieves the necessary linkages, oversight and control to operate a program. In round 1, we just asked you to list the chief investigators and what their role would be. And that doesn't actually show the mechanism that's going to govern the Centre of Research Excellence. In this round, we're asking you to actually show the mechanisms, to list the multiple dimensions, the people, the roles, the structures and the policies. Why would we have a high expectation for well-developed governance models? Because that's what's going to provide the direction. It's going to allow the Centres of Research Excellence to periodically review the interim results and identify and execute adjustments that will ensure the achievement of the planned outcomes. Another very important aspect of governance models is that it will allow you to identify a risk management plan. And as we're saying, in 4 years, a lot can go wrong. Some areas of your research you will know are going to be a little bit tricky and you'll need to plan for those and have a fallback plan if something goes wrong so that you can mitigate some of those errors or problems. For example, the NH and MRC recent problem with their IT, I'm glad they had some plan in place to manage that because it could have been dreadful. So where to start? I'm a firm believer of working backwards to move forwards. So the first thing here, of course, is to clearly define the aims and outcomes of your Centre of Research Excellence and use that as the focus for working out who is then going to be in your research team, what skills do you need. You might need all clinicians, you might need a mixture of clinicians, of statisticians, of health informatics people. It doesn't matter. Whoever you need to achieve your aims and outcomes is who you should start looking at for roles and functions. From there, go to your organisational structures. So there are different levels of organisational structures. You can have steering committees and advisory groups, and you can have steering committees and advisory groups at each different level of your CRE. For example, you might have them at an executive level, you might also have them at a project level, depending on what your research is aimed to achieve. Bob, are you going to talk to us about some knowledge translation and exchange?
So you'll do the button? Thanks. Yeah. I'll do it for you later, yeah. Okay, so I just can't see that. That's all right. No, I got it up. It'll fade. Yeah. All right, knowledge and exchange. What is it? Look. There's a vast array of literature about knowledge and exchange. most of which I think is theoretically helpful but practically hasn't achieved a lot. The APHCRI model builds on an actual model from Canada, and that's been the basis of it. However, like all things, it can be improved, and with the APHCRI experience, we've tried to adapt that model to the Australian situation, and also to build on that model. And the parts of the model we have adapted and have kept are the presentation of research findings, both in that 1:3:25 format, and that's described on our website in some detail. And I think many of you who've been involved with APHCRI will be intimately aware with that. And that's been proven to be a useful way of communicating. We've also, as part of that, included very much a lively program of interaction between the APHCRI funded researchers and the Department of Health and Ageing. And that has taken the form both of having, for some projects we've funded over the years, having departmental people on advisory or steering committees, and that process will continue with the CREs, and also with presenting the findings orally to the department here in Canberra through a number of mechanisms, either special presentations or part of a series we have with the department called Conversations with APHCRI, where all the interested policy people from across the department can hear a presentation of the research and follow it through. Then once they get to meet those researchers, often there's been a lot of follow-up, and I think that's one of the more successful features of this, that it does lead then to building an ongoing relationship between researchers and departmental people. So that's another mechanism. We've now taken this a step further, and Vicki mentioned Peter Mcinnes, who's joined us a couple of weeks ago. Peter's on a one-year secondment from the department to work with us in APHCRI, and Peter was selected from a very competitive process within the department, so there's clearly interest in the department in extending the policy network into the research network. And I think this is an important development, because it's one thing to focus on the research end of it and say, well, you research guys have to get your act together and present your material that's relevant to the department and so on and so forth. But of course there's also at the department end, there's a need for the policy people who are busily doing policy, whatever that entails. But a lot of that entails very rapid work and what if type, what if we did this, quickly finding out what might be the consequence of doing X or Y. And most of it done in a sort of a very tight budgetary environment where it's not, you can't just put an ad in the paper and you can't talk to anyone outside the department, need to know and all that sort of thing. So it's getting the departmental people, I think, a better handle on, well, how does a research field actually work? What can you expect from the research field? It's not just a case of give them a question and they'll give you an answer. It's more subtle than that. And sometimes the question can't be answered, or can't be answered in a time frame that suits the policy. So I think having Peter on board will, we hope, and I'm sure it will, give us a better chance for the feedback from the departmental end to come to us, but also from the feedback from the research end to go back to the department. What's the most useful way researchers and policy people can interact? Or ways, because I don't think there's any one way that fits all purposes. So that's our, if you like, the nub of our knowledge translation and exchange. We do that in relation to the work that we have funded, or the questions that might come. And one of the outcomes I would hope from Centres of Research Excellence would be that the departmental people have access to a body of expertise which they know is built on excellence. It's been formed. It works in this area. They're the sort of the experts in these fields that they can go to from time to time, even just orally on the phone, and say, look, What do you think about this? We've got this problem, blah, blah, blah. And so without there being a whole process of research undertaken to answer that one question, the experts can say, well, look, we think the answer might be here, or we're aware of some work that was done over there, and there's an iterative process between the policy people and the research people. So I think it's all about building relationships, and the evidence of where policy and research can work well shows that a lot of it is around relationships. I think that covers it for now, and we can. Sorry, I think that covers it for now. We can take more questions, but that's what we're on about here. Is really that last statement I made: building relationships and looking for effective tools, and the innovation that Vicki and Dagmar mentioned in research also, I think, extends to the knowledge translation. We are looking for ways that work rather than just a formula that we apply. So I'll leave that for now. Thanks. Will.
Thanks, Bob. And thank you, Dagmar. So Bob's talked a bit about the ethos of our communications and our knowledge exchange activities at the Institute. I form part of the communications and media team, so we kind of look at doing things on the ground. And so Bob's talked about the 1-3-25 reporting system. There's also, from time to time, when travelling fellowships come up, or when research groups have finished their projects, that we look at organising the dissemination of those findings, and we can do that in various ways through the public lectures that we often hold here at the ANU, organising some stakeholder engagement sessions where the lead researchers can talk about their research and how it impacts on the primary healthcare policy landscape. And also Bob has really talked about the ongoing sessions that we hold at the Department of Health and Ageing through the Conversations with APHCRI series, and also other presentations as they arise. The key questions that we look at, and I'm just giving you a very broad overview of it. The communications and media team work with the different teams, talking about how they might like to get their findings out into the community and also into the policy sphere. So we have a discussion about that, about what you're trying to achieve, who you're trying to communicate your findings to. Often, thinking about your audience, it will change. You'll have policy advisors within the Department of Health and Ageing. It might be at a state level or at a territory level, or you might be looking to influence different policy groups, whether it be the Australian General Practice Network or a nursing group, what have you. So we involved in those discussions with you. Often thinking about a different message for a different audience member, so we can help you tailor that. And thinking about the different models that we've got, whether it's a media release that we might work on together, or it might be a report or what have you. And then there are different ways that we can go about disseminating those different items. So the key message I want you to take away is that we're here to help you. If you're lucky enough to become part of the network, we can help you develop a communications and media strategy for your project, whatever it requires. But we also say that you should think about this ahead of time and involved in discussions in terms of what it's likely to cost, and so you can build that into your project budgets. But I think that's it. Thank you.
So what are the research themes? What we've done is we've aligned the research themes with the national key direction areas of the National Primary Health Care Strategy. The research outcomes from the Centres of Research Excellence will generate new knowledge to support the implementation of that strategy. APHCRI anticipates that the Centres of Research Excellence will lead the nation with innovative research that will raise the profile of Australian primary health care research as a leader in the international arena. APHCRI Centres of Research Excellence can be at the forefront of international primary healthcare research. Research findings from the CREs will result in an efficient and effective health policy that leads to Australian health service delivery being among the most proficient in the world. But what we need to do is build that innovation into these Centres of Research Excellence. So how do we do that? We do that through an interaction of the sub-themes and the major overarching themes. Can we do a sort of backwards and forwards flip in these? So can you go one more forward on this? So here, you'll see this in your information for applicants. This chart shows you it shows you 4 the overarching themes. What we've done for simplicity and to streamline matters is to roll themes 2 and 3 together into theme B. So actually, theme 2, I think, is prevention, and theme 3 of the National Health Directives is management of chronic conditions. So we've pulled those together into B. So across the top of our chart, we've got the 3 national key themes, and then on this chart, we've got 14 sub-themes that you can address, and Bob's just flicked to the extra 4. Thank you. So there's actually a cross-match of 4, a cross-hatch of 18 themes that you can address. We understand there will be overlaps, that it'll be very hard to stick within one theme A and anything that's underneath that. So can you just go back one to the big chart, please? Thank you, Bob. So what we're looking at is the 3 national themes, and you must address at least one of those. And you've got those 18 sub-themes. So common to all of those sub-themes could be the last 4. So these ones can appear under any of the 14 in the chart. A research design illustration may be that you propose a study that seeks to identify the optimal workforce mix and training, which is sub-theme 16 up here. Required to facilitate the provision of primary health care services to adolescents, which is sub-theme 4 on the left-hand side here. Can you see how there's an overlap already happening? That promotes self-managed care of chronic disease, so we're addressing priority area B. Secondary outcomes might include reduced hospital admissions, sub-theme 11 on the bottom of the central column, and improved regional and service integration, sub-theme 5 in the left-hand column. So in actual fact, this innovative research project is covering the national key priority areas of A and B with a number of sub-themes that are actually putting the flavour and the interest into the research proposal. So I guess with that matrix of themes and sub-themes, that allows you the depth and scope of creating a very innovative research work for your Centre of Research Excellence. So please do have a look at the handouts because it's really clearly explained in that. But remember that you can't just pick one of the sub-themes, you have to relate it to the national key priority area that's going to influence policy, systems and service provision in Australian healthcare delivery. Thanks, Bob. Terrific. Now, the Expert Review Committee needs to see details. They need to ask the who, what, when, where and how of every aspect of your research proposal. So while it might be easy to address those regarding your research methodology, remember that that's only one component of your proposal. You also need to address those with your knowledge translation and exchange model. Who is going to be responsible for that? How is that going to occur? At what stages of my 4-year program will knowledge translation and exchange occur? The governance model, who's going to be involved? Why? How? Your PhD students and your postdoc fellows, How will they be involved? Who's going to supervise them? Where will they be located? And when it comes to an international visiting expert, it's probably not a good idea to just say, look, we'll get one, trust us, just give us $8,000 to bring them out. We actually want to know who this person is going to be and how they're going to relate to the research outcomes and aims of your Centre of Research Excellence. So this is why we're giving you 3 months plus a couple of days in our generosity to actually work everything together so that you are providing a very well, thoroughly prepared proposal so that the expert review committee aren't left standing going, well, we don't understand this, where's the extra information? This is your one chance. You don't get a second chance at giving the information and answering their questions. Thanks, Bob. Now, looking at the budget, again, that can often cause a few questions. Outside the front is a modern version of the Centres of Research Excellence Handbook. Please take at least one or some of those if you can, and all the budget items are included in that, as well as in your information to applicants pack. So it's pretty clearly explained, so do have a look at that. We will cover your direct research costs, but again, the expert review committee will say, well, how come they're asking for this? It doesn't relate to their methodology or to their research design. So everything's got to dovetail one into the other. Ambit claims don't sit well. We will cover the costs of consumer involvement, of your knowledge translation and exchange activities. The justification is one area where the chief investigator, A, can actually explain why you're asking for this particular pocket of funding. It might be something slightly unusual, such as access to a data bank, but if the CIA can actually justify that cost as being integral to the methodology and the research design, they've got a good case of getting that funding. Make sure you've used the most cost-effective means for a particular request. A lot of our collaborative work will be involving centres across Australia, and it's often not cost-effective to expect a team of CIs to travel from Perth to Darwin to Brisbane or Melbourne for meetings. Maybe the most cost-effective way would be Skype or video teleconference or ordinary teleconference. The Expert Review Committee are accountable for the most effective expenditure of government funds, making budgetary justification among their particular interests. Thanks, Bob. This slide is just for your information, so that if you are one of the lucky ones to get a CRE, these will be your reporting requirements, and they are according to your contractual obligations. So annually, you will be required to report against work completed to date. That will include publications, your collaborations and what you've done collaboratively, your KTE endeavours, student progress, an annual financial acquittal, and a detailed research plan for the forthcoming year. In your one annual meeting with APHCRI where you will come to Canberra, you will also be required to prepare a verbal progress report of progress to date. And as we've said, the final progress report will be in the 1/3/25 format. Again, that's explained in one of these booklets outside called Author Guidelines, so do pick up a few of those. If you have any trouble with the templates, please call APHCRI because we can help you use and get your head around those templates. Some of them are a little bit tricky to work with. So I think Bob's going to talk to us a little bit about the contracts and how to deal with a contract.
Thanks, Dagmar. The simple word is expeditiously. We've taken the approach, we've had various issues around contracts, and as those of you from universities will know, when you get a grant, the hardest part of getting the grant is actually sorting out the contract with the funder. We've tried to streamline that process further for this round of CREs. We have a contract. The money we use to fund these projects, as we've said several times, is comes from the Department of Health and Ageing, and that comes by way of a contract or a funding agreement between the Department of Health and Ageing and the ANU. And the ANU, as part of that contract, has to meet certain obligations. I'll call it a contract. It's technically a funding agreement, but it's effectively a contract. There are two parts to that contract. One is a general part, which is a standard Commonwealth Government requirement for all funded or funds they hand out. And then there's the schedule to the contract, which is the specifics that have to be met. We pass that responsibility or that risk on to the institutions that accept the grant from us. And again, we pass on the contractual obligation in the first part, if you like, the core contract, in terms that our lawyers have advised us is this university's way of meeting its obligations in terms of delivering back to Doha on that contract. So we've taken the view now that that part of the contract will not be negotiable. We've put that contract on the website, that part of the contract, and we've got the reference there. I just emphasise that will not be negotiable. If you were to be offered, if you were to apply and offered a funding, and then your university or institution were to say, well, sorry, we don't like clause whatever, well, I'm sorry, we're just not going to negotiate on that. We have a clear policy view from this university that is required for us to meet our obligations, and we will do that. The second part of the contract, of course, is negotiable. That's the schedule to the contract, and each of these CREs will have a different schedule because each of them is doing different things. Now, there's some timelines in there which sort of aren't negotiable, but I suppose there is prospect as part of any grant for that to be changed, and there are some funding suggestions how we would, the way we, a small amount of funds in the first year, maximum amount in the middle 2 years, and then tapering off in the third year, because we can't guarantee the funding will continue beyond year 4. In fact, I think we can probably guarantee it won't continue beyond year 4. And certainly that's our funding capacity ends at the end of year 4. So there can be some negotiation around those elements of the schedule and the conditions we might put on the grant as a result of the Research Advisory Board's advice on how the grant should be funded. But I just want to emphasise again that first part of the contract is not negotiable, and we will not negotiate with institutions about that first part of the contract. And if you think you're going to have problems with that, you probably need to do more work within your institution to sort that out before you finalise your application. And we will expect the contracts to be signed within 30 days of the offer of award. Now, the offer of award will include the conditions that the R8, the Research Advisory Board, requires, and we will have discussed those before we make the formal offer. So it should not be a burden to complete a contract within 30 days of the offer, because the offer of award will, as far as we understand it, will be what we've agreed in terms of special conditions for that particular grant. So this is important, and we would hope that we don't come to grief with a solid proposal that we're keen to fund, and then there is some issue around that core contract which is going to cause the whole thing to founder. Now, we haven't taken that approach before, so that's why I'm perhaps emphasising it more than you might have thought I would normally. That is now our position, and we will not negotiate on that. Applications opened on the 10th of March. They closed at 5 p.m. Australian Eastern Standard Time, because daylight saving will have finished by then, on the 3rd of June 2011. So that's Canberra time, 3rd of June 2011. So wherever you are in Australia or the world, that's the time you have to meet. So that gives you a little over 12 weeks to do this. Some people will say that's not enough, but we're getting a balance here between giving maximum time to people to get their proposals together, particularly as these are complex proposals and they're collaborative proposals, and giving a thorough assessment process, and that takes some time, and getting the grants announced around about September, October, so people can start to prepare themselves. And we know that there will be many current recipients of the RCBI component of the APHCRI strategy who, the consequence of the outcome of these might affect people currently employed one way or the other. Either they'll be able to continue employment or they will not be able to continue employment. So we are anxious to get these grants announced as early as we can. So we think that balance of 12 weeks up front and then announcements sometime, hopefully by early October, gives the best balance we can do. And then the funding will commence January 2012. Now that's important as well because, as I said, we only have 4 years of funding. We cannot extend this funding beyond 4 years because contractually the department's money must be expended within that period of time and can't be carried forward beyond the 4 years. There's some capacity within the 4 years, but once we get to whatever it is, 31 December 2015, that's it, game over. So it is important that that the CREs get up and running as quickly as possible. The process we have, so they come to us in electronic copy and hard copy by 5 p.m. on that date, and all that information is in the package on our website, and I think in the document we've given out. No, not that one. No, but it's on the information for applicants on the website. The process we have is the APHCRI takes the advice of a research advisory board, which is appointed through a process between the ANU and the Department of Health and Ageing. The membership of that board is actually on the website. The Research Advisory Board appoints an expert review committee for each round of funding, and the expert review committee for the Centre of Research Excellence will include 2 non-conflicted members of the RAB, 2 non-conflicted Australian experts who are not members of the RAB, and 2 international non-conflicted experts. And that's not easy to achieve. So we're dealing with a small pool of researchers here, so it is certainly not easy to achieve. But that's the expert review committee. The expert review committee is convened. It considers the applications. It generally doesn't seek outside advice by way of references or whatever, although it may should it choose. But it's a fairly efficient process, and that's why we're optimistic we can meet that deadline for announcements. I think that covers it, doesn't it? So it's up to questions and answers now. Am I right?
Yes.
Yeah.
I just wanted to point out too, with questions and answers, that we understand there may be a number of questions that may not be able to be answered in this time frame. We don't know how many people are listening live online, and we need to incorporate those questions with the on-floor questions that we have today. So if anybody misses out on getting their questions answered today at this session, or in the interim between now and the closing date you think of, oh, but what about this? You can place your questions to this email address, director.APHCRI, which I think is Bob, in writing. We will only take questions in writing, and they will be answered. They will be de-identified, and the question and answer will be placed on the FAQ site at APHCRI under the Centres of Research Excellence Round 2. So you've got those addresses there, so please link into that regularly to see if there have been any upcoming questions. What happens is when a new question comes in, I think there was a question placed last week, it gets answered and put up on the FAQ with a red flashing sign saying new, 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 and that will stay flashing for 1 week. So anything that's still flashing red has been up there for a week. Anything that's older than a week will just be ordinary and stay there, but new incoming questions will have the flash alert. So please, we can't speak to you for the reasons of probity. We have to make everything fair and give everybody an equal chance of applying and being successful. So this is what we thought would be the best way for people to access any additional information that might come forth between now and the closing of the application process. Did you want to add anything to that?
Can I just add, we used this FAQ process for the round 1 CREs and it worked quite well, I think. We got positive feedback from it. But I emphasise, don't use the answers to the round 1 FAQs for this process because the rules have changed, and if you rely on in fact we've taken the FAQs for round 1 off our website, but that doesn't mean some people would not still be using them through printed copies or whatever. They do not apply to this round. We will not stand by any answer for that round in relation to this round. And where I think we're going to add the ones that are relevant, we're working through those now, we're going to add those back on. But you can only rely on the FAQs round 2 CREs. If you rely on anything else, you do so at your own peril. Okay.
Okay, now just a quick interjection. For web audience questions, I found it a little bit tricky because I'm challenged in that aspect, how to place your questions. So for you, audience out there, at the far right centre of the screen, click on the pen symbol as if you're going to write in the menu bar. That'll open up a spot at the top on the right-hand side where you will add your nickname and then click enter. And then when it opens up, you'll see a large white box and also a text line. So type your text into the text line, and when you finish typing your text, click on Say. Now that will come up with our moderator here on my left-hand side, Will Wright, and Will is going to be able to pick up all of your web questions. So we'll do an interchange of live audience questions as well as web questions. I've got 2 roving mics. Laura, are you still happy to do a roving mic? And Loran? Okay, all right. Now, for the roving mic, I'm not going to let Laura let go of the mic. She's going to hold on to the mic the whole time. Because we're webcasting, we need to maximise the clarity of our audio, and that's the best way to do that is for her to just grab onto the mic and hold it between 4 to 6 inches away from you. So even if you move, she's going to follow you within 4 to 6 inches. I'm going to try and adjudicate with Bob's help, and Bob's going to hopefully answer as many questions as he can. So, do we have anybody on the floor with a question?
I was just wondering if geographical spread across Australia was important in terms of the collaborating institutions?
You can collaborate with any institutions across Australia or internationally.
Does it matter if all your collaborators are in the same state, for example?
No, it doesn't. The only requirement that we have is that at least one of your collaborators has not previously received substantial APHCRI funding. Okay?
And also, you can't have on your application a chief investigator from a current CRE as a chief investigator on this CRE as well.
Okay. Do we have a web question at all, Will?
We've got a question from Fran. When will the membership of the expert review committee be known?
We're still forming the expert review committee, and when we have that finalised, it will be made available. But I can't commit to when that will be.
Okay. Kathy?
How many CREs do you intend to award?
Up to 7, if there are 7 that meet the requirements and are sufficiently innovative. There is funding for up to 7.
We also, of course, reserve the right not to fund any if there are not sufficient of the standard. And we also could, if there were promising ones that don't quite meet the mark, have a process of trying to bring people together or whatever. If there was a shortfall. So, but if we get 7 applications that meet the mark, we can fund 7.
Is there another live question?
There is.
Oh, sorry, online.
This comes from Ellen. You briefly mentioned the Primary Healthcare Research and Information Service, also known as PCREs. How do you see PCREs working with APHCRI and the CREs?
One of the details we didn't really go into was what we have done with the first three, and when the next group are announced, we have formed an APHCRI CRE network, and on that network are the chief investigators of the funded CREs, plus departmental nominee, plus the nominee from PCREs, the Primary Healthcare Research Information Service. So PCREs is an integral part of the CRE network. Their key expertise is knowledge exchange, and so they're integral to the whole process. That's not the only link we have with PCREs, but in terms of CREs, that's the formal linkage of this network. But the detail of that really is once we get the CREs, people will be dragooned into invited to join the CRE network.
You hold it, okay. Bob, you mentioned a bunch of outcomes that you're really interested in, and the most important one you said was developing relationships. Now, that was relationships with people in Doha, or who?
Well, obviously, if we don't develop relations with people in Doha, I think we'll fail the test. But I think it goes beyond just developing relations with people in Doha, and other stakeholders would include what I call the NGOs, national bodies, which could range from professional associations to disease-based groups, to bodies like AGPN and so on and so forth. So I think, and of course consumer groups. So we don't want to say you've just got to focus on building relationships with Doha. You build relationships with people who are involved in the policy process around the area of research you're undertaking.
Okay. So from a sort of hard-nosed point of view, if you're like, when I'm writing an NHMRC grant, they ask, what are your policy achievements?
Yeah.
And I find it really hard to know, how do I make it visible, all these relationships that I'll be developing with the CRE that I go for? Do I just put down, I had a chat with so-and-so, and that's the outcome? How do you solidify all these relationships that
Yeah, it's probably more than chats, I would think.
And other sorts of demonstration.
Yeah, a good example would be advisory committees that CIs or others on the grant are involved in, or it could be participation in policy processes. So sometimes the department will convene, or other groups will convene a national forum to discuss a policy process. It could be an ongoing link with a particular policy group, be it a state government group, a federal government group, or a local community group. It's demonstrated actual activity. Now, whether that results in a change of policy, I defy anyone to link that. So we'd love you to be able to say, well, we actually, changed the policy around X, but I doubt very many people will do that. And if they said that, we mightn't believe them anyway. So
that was the final part of my question. The whole point of this exercise is the relationship between research and policy.
Yeah.
But I've always been really worried about, what do you mean by change of policy? Have you ever seen an example of where people have done, in primary healthcare, have done research, and then they can say, oh, there's that policy down there, and it's directly linked to our research?
The only example I've ever seen of that was a policy that failed. We're not looking for that. I think that's in many ways that's a researcher's view of how policy works. It's serial, and it follows logical steps, like of course research does. But it doesn't work that way. So I would be suspicious of anyone who says, well, we did this body of research and bingo, it became the policy the next day. And it worked. So it's more about the relationships than about the outcome in the sense of proving you changed a policy. Because I just don't think it's as simple as that. And it'd be very hard at the end of this to demonstrate that we've changed policy.
So we shouldn't attempt to do it?
No, we should attempt to inform policy. And our relationships will be examples will be how we demonstrate that we've helped inform policy.
Okay, we have a question from the web audience, please.
Thank you, Dagmar. We've got a question from DM. Previously, there's been a requirement for there to be collaboration between those funded by APHCRI and an APHCRI naive group, so previously funded, I should say. Does this requirement still stand?
The premise of that is incorrect. There was never a requirement that there be a previously APHCRI funded group in a proposal. It was at least one had to have not been funded by APHCRI, but it was possible for the whole team not to have been funded by APHCRI, but it was not allowable for the whole team to have been funded by APHCRI. That rule hasn't changed, so it's incorrect to assume. The way we worded it was to make sure that at least one team had not been funded by APHCRI, but that didn't mean the other team or any other number of teams had to have been funded by APHCRI.
Is there a question from the floor? Okay, we do have another web question.
Okay. We've got a question from John, looks like Management ACU. Just for the idea of general competitiveness, it's a two-part question. How many applications were received last time? And the second part of the question is, what was the amount funded as a percentage of the funds requested? I'm not sure if
I understand that.
Yep, okay.
There were 27 applications last time, and there were 3 funded. I don't have the information about what proportion that is of the budgets that were requested, but the 3 were funded at $2.5 million each over 4 years, and that's really all that matters. We don't fund a proportion of budgets, we fund a fixed amount for each CRE, $2.5 million, and if they ask for more than $2.5 million and they're successful, they still only get $2.5 million. So the question of proportion of funds asked for is not relevant.
Okay, there's nobody from the floor. Is there another online question at all, Will?
Okay, so follow-up. I might just, he had a follow-up, John, Management ACU, so he said, just noting my question, I'm aware of the differences / changes since the last CRE round. He said his question was just about, just after getting a general idea of the competitiveness. The next question we've got from Anne Dadich. To leverage existing capacities and reduce, if not avoid duplication, what opportunities are there to develop external governance arrangements between proposed and existing CREs?
Did the people in the audience hear that question well enough? Thanks.
Do I need to say that again?
Yes, please.
So from Anne Dadich, to leverage existing capacities and reduce, if not avoid duplication, what opportunities are there to develop external governance arrangements between proposed and existing CREs?
I'm not sure I fully understand the question, but first of all, the requirement is that each CRE have a governance structure for that CRE, and there's, the information about those is in the package of material. So they need to comply with that. If they wish to form links with existing CREs, there's no restriction on that occurring. However, there is a rule which I alluded to that a chief investigator of an existing CRE cannot be named as a chief investigator on a successful bid for round 2 CREs. I mean, they can be named, but if they are, the thing will be ruled invalid. So I'm not sure if that answers the question. If not, perhaps they could send a follow-up email or whatever.
Any questions from the floor? Yes, we'll take yours.
Question, John?
It seems to me that there could conceivably be a tension between the sub-themes and overarching themes and the desire of some primary healthcare researchers to focus on a particular clinical area. I notice that mental health is a clinical area that's mentioned in the document. Is it possible for researchers to look at, say, a particular area of chronic disease and apply the sub-themes and overarching themes in that area and still be regarded as competitive in this application round?
So Dimity, I'll just put the question back to you, just make sure I've got it correct. Is it possible to say of the, say, pick theme, sub-theme, where's the mental health one? So there is a mental health. Well, let's say adolescent health.
Yeah,
Let's pick adolescent health. And just focus on adolescent health either as an issue under one of those major streams. Is that what you're saying? Just focus on adolescent health?
Well,
Say,
I was thinking more of prevention and management of chronic conditions, picking one chronic condition
oh, yes.
rather than all of them.
Yes.
And then looking at those and maybe various other sub-themes under that.
Yes.
Would that be all right?
Yes, that you could pick mental health, or you could pick diabetes.
Yes,
or
that's what I meant.
correct. Yes,
That would be all
that
right.
would not be excluded. No.
Excellent, thank you.
Yep.
Lorraine, I think, was next. Thanks.
I'm just wanting to clarify under the thread B there, whether this is prevention, semicolon, and management of chronic conditions, or prevention and management of chronic conditions.
I think it could be, you could have a semicolon, a virtual semicolon there, should you choose to, yes. Because what we've done, we've just conflated there what were actually two separate ones. So, yes, if you want to focus on prevention, that would be fine. Or if you wanted to focus on management, that would be fine. Or you could do both. Yeah.
You've made it clear that innovation, knowledge translation and informing their healthcare policies are important. How much will track record of the applicants be taken into account, or is it more about capacity to produce the research that they've claimed?
Look at the section of the information for candidates. We have got a number of criteria which are equally weighted, and track record is one of those. So we are looking for track record not just in research, but also in policy engagement, which is building relations or whatever, similar, the points I make in relation to Marianne's question earlier. So we do want some track record there, not just promise of doing things, but the track record might not be precisely in the innovative area that the proposal is promising, but there is a track record that the CIs, either all, or collectively or individual ones, have a strong track record in engaging in policy processes.
There are a couple of sections in the information to applicants that actually address that. Yeah. Will, is there an online question?
There's an online statement followed by a question from someone else. So Ellen has written in again just to say, asking me to let the audience know that they can go on the APHCRI website for information on knowledge exchange that they might find useful in preparing their application. Anne Dadich has written in again just to say thank you for the response. But for clarity, I was wondering whether formal opportunities will be established to connect the CREs and the respective research activities. So,
could you repeat that, please? I'm sorry, I just missed that last bit.
yeah,
The question, not the statement.
she was wondering whether formal opportunities will be established to connect the CREs and their respective research activities. I've actually just asked her for clarification on some further clarification on what she means exactly by formal opportunities, but
Perhaps she means with PICREs. No?
It's not clear.
No. Okay. Well, if Ellen would like to clarify, we're happy to do that. Yeah.
Any other questions from the floor? Any other questions online?
That's it.
Okay.
All right. Well, can I just close and thank everybody, both those here and those online, and particularly those who've put questions through online. I don't think I could manage that process. I would have been waiting and sending an email later. I'd also like particularly to thank Dagmar for the work she's put into the documentation around this process and today's event, to Will and to the IT team here who've, I think, done a tremendous job in the face of the system's desire not to participate fully in our process today. So thanks very much, guys. Really appreciate it. Thanks, everybody.